New at 5, big changes for Oklahoma asthma patients insured by Blue Cross Blue Shield.
Patients with that insurance carrier will be required to take their asthma injections at home instead of at a medical facility.
Fox 23's Jade Morrow's live in the newsroom after finding out why this is happening and the concerns from some caregivers.
Well, according to Infusion Providers Alliance, this policy is putting those who have severe asthma at high risk. On April 15th, patients insured with Blue Cross Blue Shield with severe asthma will be made to inject themselves with their medicine rather than turning to a clinic or doctor for assistance. Those who take injections like Xolair, Tespire, Fasenra, and Nucala, no matter their age, are at risk. I spoke to Brad Travers with Infusion Providers Alliance, who told me why Blue Cross Blue Shield is making this policy change.
It's money. It's purely a money reason. They you get paid for biologic drugs for injections and treatments either through the medical claim, where the physician administers the drug for the patient, or the pharmacy claim, where the physician is completely out of it.
I spoke to a local asthma and allergy clinic near 71st and Yale who says their concern is patients not being able to do it themselves at home, as they're comfortable with certified physicians to do it for them.
I do think, in the past, whenever something like this has come up and some plan has dictated that the patient has to do it at home, there have been people that have anxiety. And I do like for patients to have options and to not, be fearful of having to do this at home.
Travers says this change is not only a mental concern, but a safety concern for patients who don't have the capability of doing the procedure themselves. If you cannot take the injection yourself, you have to provide proof.
You have to prove if you have a disability. You have to prove that your caretaker is not able to do the injection itself, that there will always be a caretaker there. There's requirements, proof that you've never really had anaphylactic shock before.
As this is going to go into effect in April, local asthma and allergy doctors say the best they can do is to educate their patients.
I think the best thing to do is to use a trainer and try our best to educate. We also have to do this with the EpiPen. People get nervous, but I think it is going to be a problem down the line, and we probably will get some phone calls about, that the parents aren't comfortable.
The Infusion Providers Alliance has a letter process on their website to go to your congressman, senator, and HCSC to put a stop to this policy change. And we have links in the story on our website at fox23.com. Live in the newsroom covering News That Matters, I'm Jade Morrow, Fox 23 News.
We contacted Blue Cross Blue Shield of Oklahoma for statement. They said, quote, "We are committed to expanding access to quality, cost-effective physical and behavioral health care. We are updating medical policies for some medications that are FDA approved for self-administration. Our policy revision is being made with the interests of our members in mind, promoting access to treatment that is convenient and effective."